Push the stance leg. So now we know that the stance leg is going to hold weight. And we've taught it the best we can about how the leg is going to go from stance to swing. All right, so the first thing on this sheet is a Dorsi wrap. Some patients don't get back the dorsiflexors immediately. So everybody knows what an AFO is, right? Mm-hmm. So sometimes we have to have AFOs. They're abnormal, and we don't want to push that button until we have to. So we can do what we call a Dorsi wrap, which is something that we can put on and take off at will to see if the AFO would be effective. And it's something that we can use until we see how much is going to come back, so we can still continue to work on it instead of throwing an AFO on a patient and just leaving it. Because once you order it, they will wear it all the time, because it's going to be easier. So now we've given them a compensation, and we may miss getting muscle back that we would have gotten back. So
Bless you.
thank you. So there is a video in Blackboard posted that you can watch, and then I always do one as well. So it's just an old neurotherapist trick to be able to do a Dorsi wrap. The whole point is to fix the toe in dorsiflexion with an ACE wrap, so that it cannot, even if they want to, they can't drag the toe. So that way, when you are managing hip and knee, that has to be managed, because if not, they're going to fall. You don't have to worry about the toe dragging. So most of the time on tile, most hospitals aren't going to have carpet, so it's kind of hard to mimic it in here because we've got carpet. But once you get that Dorsi wrap on, if they've got a toe drag, when they bring it through, it just brings it through this way. So their toes are just naturally going to be up. So then we don't have to worry about this happening. Okay? All right. Who wants to be a guinea pig? Then have it has a fabric layer, and then on the tile it's going to go right through. So this is not something that we are terribly worried about wrinkles. This is not something that's going to stay on. So throw away everything you know about wrapping anything. Okay, this is totally different.
I'm terrible at wrapping.
No. This is about pull, and this is about getting it anchored down here, anchored up here, and then getting the line of pull correct. Okay, so this is not, it doesn't have to start on one side. It doesn't have to, so just don't panic, okay? Now, if you do have somebody that is, the drop foot, they typically have a tendency to drop this way, right? So it's best to get a line of pull that kind of pulls them in this direction. So I usually get 2 down here, and let me go just a little higher under the ball. You really want to be up right underneath the toes. So somebody with a small foot, this might be a little bit tougher for. So I'm going to get the 2 right up near the top, and then I'm putting that foot in dorsiflexion. Then I'm going to come up here and get me a couple down, or 2 or 3. Hate that.
Keith said not times, but I've done that too.
Yeah.
Just drop it.
Well, see, it happens to everybody. And again, wrinkles, we don't care. Yes, it's going to be tight because it has to be tight to do its job, okay? So we're not attempting to cut off the circulation, but this is something they're going to wear 15 or 20 minutes for gait training, and then it's going to be on. So then we're going to hold it in Dorsi while we come back up underneath it again, that's alright. I'm almost ready. And then when I'm done for the last time, see how I've got like this X right here? I'll take it down through there. I'm gonna pull her up.
Is it supposed to feel? I don't feel like too tight. Is it supposed to feel tighter?
Well, these ace wraps are about get going.
Yeah.
It don't have much. Should just feel like it's holding you in neutral or in a little bit of dorsiflexion. Yeah?
Yeah.
So get up and walk with it. Now
Yeah.
you can really see.
Yeah. I feel like my toes are being held up.
Yeah. And that's the whole